Hello. So I'm an endocrinologist with 23 years of experience. I have come to this channel for educational purpose. There is no commercial uh, intent in this, and this is not for medical consultation. So why I am saying all these things, that because many a times I see patients in OPD who are coming with similar problems, and I have to explain to everyone, and the same complaints are of so many people, that if I answer those here, then lakhs of people will be benefited, rather than only the person or people who are coming to my OPD. So today the most difficult problem, which medical problem which people are facing, is obesity. And a usual story is, ma'am, I'm doing dieting, I'm doing walking, but still I'm not able to reduce weight, and I'm eating less. So this story goes on for every patient. This goes on. So many a times it is actually not that you are eating less, but the thing is you're not counting it. So first and the foremost thing is, I just ask them to calculate their calories, how much they are eating, and I also ask them to document how much they are moving. So despite adequate diet control and movement, they are not able to reduce weight. So what is the reason behind that? I will talk about in two parts. One is the science-based things, which are published, peer-reviewed things, and second thing is what are my beliefs and my clinical observations. So, saying this, weight loss is not some simple calculator that you eat less, move more, and you are able to reduce weight. There are so many things which are important for weight loss, which includes resting energy expenditure, adaptive thermogenesis, and gut microbiota, environmental disruptors, and so on and on. I cannot describe all this in a single video, but I'll try to talk about some of the important hormonal regulators which make you difficult to lose weight. So one is, which we all know, is chronic stress. So chronic stress lead to all our other counter regulatory hormones like cortisol, catecholamines. So if we talk about specifically about cortisol, what happens is, higher the cortisol, it leads to more of fat around the abdomen. So that leads to more of insulin resistance, more of lipid problems. So chronic stress leads to increase in cortisol, although we do not have anything to measure it like cortisol is high, but people are working on this to define criteria for stress related rise in cortisol. Although disease related rise in cortisol, we do have criteria. Now we talk about insulin resistance and hyperinsulinemia. So we know weight gain leads to insulin resistance and hyperinsulinemia, which again leads to more of fat accumulation. And it's a vicious cycle. More of fat, more of insulin resistance, and more of again adipogenesis, more of insulin resistance, more fat gain. So it keeps on, the cycle keeps on, keeps on, keeps on. Similar to insulin resistance, there is also leptin resistance. Leptin keeps us thin. So if there is resistance, our brain thinks that we are starving, so eat more. So similar to insulin resistance, there is leptin resistance. Then comes PCOS. Around 10 to 13% of the people, of the women in reproductive age group, are having PCOS. That also leads to insulin resistance and multiple other endocrine problems, which again puts you at risk of more weight gain. More is a weight gain, more is PCOS, more is PCOS, more is insulin resistance, and more is fat accumulation. So it's a vicious cycle. So then comes sleep deprivation, and that is one of the important thing which leads to rise in cortisol, hyperinsulinemia, and all those things. And there are multiple reasons that people are not able to sleep. One of the important reason is phone. Then is gut microbiota. They are again very much the alteration in gut microbiota also determines our weight gain with a particular food or weight loss. vice versa. Then environmental disruptors are also there, which actually need a separate video, which I'm not discussing right now. These are the chemicals and other things which are there present in our food, which are also again harmful. Now, why eating less doesn't help us very much? First, because if you eat less, then what body tries to does is there is adaptive thermogenesis. So our resting energy expenditure, that the body which uses energy at rest, that goes down, because body tries, thinks that okay, the person is eating less, so I need to conserve energy, so our resting energy expenditure goes down. Second thing is, if you are just restricting calories without thinking, then it leads to muscle catabolism, so muscles get destroyed, and which then again this decreases your resting energy metabolism and your ultimate power to work. Then there is a trial which is named as direct trial, in which they use structured nutrition therapy and lifestyle modification under medical supervision, which led to diabetes remission in almost 50% of the subjects. So, but you listen to me, it is structured under medical nutrition, under a medical supervision, not otherwise, which can lead to remission of diabetes. So, and similarly, there are multiple studies where weight loss has been documented under medical supervision under proper guidance. So whenever you are trying to reduce weight, you should take proper consultation, get your testing done. You focus on proteins as well. Protein intake should be adequate. You should take care of your sleep, because sleep is a medicine actually. And you should also do resistance training. That means you should work on your muscles at least twice per week. You should manage your stress, because that will decrease your cortisol levels and it will be easier for you to reduce weight. And this is all peer reviewed things. Now, as my personal opinion, that also I'll like to say, although there are not many studies for this. So people who change from deep, not only that eating less and moving more, but who change from within, they decrease their stress, they follow forgiveness, they rest guilt free, who connect to nature, who meditate, it becomes easier for them to reduce weight. So, the patient which I was talking about, she was a mom and she was doing 9 to 5 job, and she was sleeping only 5 hours. So, what we did, we decreased her stress level, we did counseling, she started meditating, she improved her sleep, her productivity improved, so she could work more in less time, and in next 6 months she reduced 8 kgs weight. So all the best for your weight loss journey.